So similar to the OTPF3, the CATS index groups ADLs into 6 categories instead of 9. These categories are bathing, dressing, toileting, transferring, continence, referring to knowing when you need to use the bathroom, and feeding. The goal is to assess functional independence, which will in turn help with assisting overall care planning, possible discharge planning, determining the amount of nursing or OT that the client may need. It also may help in predicting the length of stay in any hospital setting. And I think one of the most important things that it can assist in doing is helping to decide the appropriate intervention for the client. The administrator is scoring for independence, so if the client shows that they're independent in function, they will receive 1 point in each of the 6 categories, and if they are not independent, they will receive 0 points. This eventually will reveal a score from 6 to 0, 6 indicating full function, a score of around 4 indicating moderate function and independence, and a score of 2 or below indicating severe functional impairment. Depending on how well the clinician knows the client will impact how long the assessment may take. It also depends on whether you're having a conversation with the client or whether you're actually trying to observe their independence and functional abilities while using this tool. It is recommended that it takes place over at least a 2-week period. That way you're able to start a baseline and then see how their progress may ebb and flow after that baseline has been set. The assessment was originally developed as a geriatric assessment in 1963 and has most commonly been used with older adults. Some conditions that this may be used for is dementia, maybe falls prevention, and many different physical changes that you see in older adults. These may be involved with balance, awareness, osteoporosis, etc. Many health clinicians are able to use this assessment, and this can take place in nursing homes, hospital settings like acute rehab or long-term care, adult day health centers, as well as home care. In terms of clinical utility, because the CATS index is assessing larger components of function and independence, it is limited in its ability to measure small increments of functional change, which also are very important in assessing a client's function and independence in their ADLs. The tool reports high convergent validity, and though there is limited data available supporting the reliability and validity, the data that does talk about the validity reports that when patients score independent on this tool, it does more often than not indicate shorter hospitalizations, more discharge, and more often success in their ADLs.